This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
Welcome to the human side of healthcare. Steve Love here along with Thomas Miller. And you know, our title is the human side of healthcare. And we are absolutely delighted that we've got a wonderful guest. By the way, it's Janet St. James, and I think most of our listeners know Janet. She is the Assistant Vice President of Strategic Communications for Medical City Healthcare here in North Texas. She worked for 18 years at WFAA. And trust me, she interviewed me, and she always asked much better questions than I gave answers. But it is a delight to have her here today.
And now you get to turn the tables.
I get to turn the tables.
This is definitely uncomfortable for me because I prefer to be the one asking the questions, not answering the questions.
Many of you may or may not know, but Janet has been very open about this. She's been diagnosed with breast cancer, and when she moved from WFAA to Medical City Healthcare, she was actually diagnosed the week before she started. That's got to be something, Janet, that really made you pause.
I don't think pause is an adequate enough description of the crisis that I was in. Honestly, I was really officially diagnosed the Friday before I showed up at Medical City Healthcare.
Wow.
Yeah, my appointment with my doctor was at 5 p.m. on Friday, so I really didn't know what I was dealing with until the midnight hour. And I called my boss on Monday morning as I'm supposed to be showing up for orientation at 7 a.m. and said, "You're not going to believe this. What do I do?" And she said, "Go to orientation and we'll figure it out." So I went to orientation about as scared as I'd ever been about anything. Because how do you walk into a job with a cancer diagnosis? And a cancer diagnosis, I knew by that time that my cancer had already spread. We could see it on the scans that it had spread to my lymph system. So I had no idea what was going to happen.
You know, as you mentioned, metastatic breast cancer, and you're going to talk about this. Many of our listeners probably have family members, loved ones, friends dealing with this. And I know you've told me you don't want to be called a survivor and you don't want to be called inspirational. Can you talk to our listeners and explain to them what you mean by that?
Sure. First of all, let's dispel some discrepancies between a cancer diagnosis, a breast cancer diagnosis, and a metastatic breast cancer diagnosis. So breast cancer is usually the initial diagnosis before the breast cancer has spread beyond the breast. Metastatic breast cancer is when it's spread to the tissues, usually the brain, liver, lungs, bones. Those are the primary sites of spread. And about a year ago, I was diagnosed with metastatic breast cancer. That is an incurable breast cancer. There is treatment, but treatment may or may not work, and it's pretty much impossible to tell who it's going to work for and who it's not going to work for. So that's what metastatic breast cancer is. That's what Shannon Doherty announced that she also has. Her breast cancer has spread to beyond the breast, and I don't know where her cancer is spread. Mine has mostly spread to my bones and significant spread to my bones. So even before I was diagnosed with metastatic breast cancer, I didn't like being called a survivor because I hadn't made it to that 5-year mark where you're considered quote unquote cured. And now I will not be a survivor. Unless there is a cure, I will not be a survivor from breast cancer. It's considered a terminal disease, and that is what it is. I wish I could change it, but right now there's not changing any of that. And I don't really consider myself inspirational. I'm just a doer, and so I'll do until I do no more.
You know, Janet, you look great today, and I know there's a stigma and a misconception that when you have cancer or some kind of terminal type cancer, you need to look and act sick. Do you have any comments on that?
Some days I feel like I'm looking and I'm acting sick, but I don't look that way all the time. And I think to the outside public, those who don't know me, they would not know that I was as sick in my cells and in my bones, especially as as the scans and the tests show that I am. I think sometimes you do look sick, but I don't think you always have to. And with metastatic breast cancer, there are emerging treatments, and you can live for years. I am very heartened by stories of women who make it a decade. I mean, that's big for me. That gives me hope. And I see pictures of other women that don't look sick. I look at Shannon Doherty, and I also think she looks great. And she's been living with this in silence for a year, and nobody knew. So it shows that those preconceptions are not always factually accurate.
Right. You know, Thomas, I know you've known Janet for a number of years, and obviously you've been...
I know both of you guys for a long time.
I think that means we're old, you know.
Or I'm old, too. Hey, I'm happy to be old.
And
We're
Thomas,
not old.
We're experienced. We have a lot of
We're
experience at this
veterans.
table. Right.
Yes.
but you've known Janet, and you know so many people in the broadcast industry. And Thomas does a great job co-producing this show. So why don't you jump in here, Thomas, because I know you've got some questions for Janet as well.
Well, the profile. We're connected on Facebook, obviously, and I've watched the way that you've lived this out loud, basically. And what kind of encouragement have you found that to be, not only for yourself but for others? Because I've seen the comments and I know the impact that you're having, and that has to feel great.
You know, it's interesting because social media can be horrible in some ways. It can be a source of bullying.
A bully source, yeah.
But it can also do some great things. And I'm there, as you say, living my ordeal out loud, not in the hopes of getting those sort of positive comments. That's not why I do it. I do it in the hopes that I might be able to help one person out there understand something. But for me, certainly, it's been a source of support. And so I really appreciate those positive people out there. It's nice to surround yourself with positivity amongst negativity.
Now, I know when you get... you have hundreds of people following you and thousands of people following you on this, and you get a lot of suggestions with that. Oh, you should look at this. Oh,
Yes.
you should look at that. Oh, you should
Yes.
talk to this person or that person.
Yes.
How have you filtered all of that for yourself to appreciate those suggestions? And and also at the same time, I mean, like with what you're facing, maybe inside one of those suggestions would be the thing. Right? You know, how do you filter that?
Well, there's not the thing out there. Hopefully there will be, but it's not there yet. But I know that people that offer suggestions are offering them to me with the very best of intentions. So I take it for that. I listen to everything, and then I use what I think would be useful for me. And because people offer those suggestions, but they don't know the genetic makeup of my cancer, or, I mean, like, I'm restricted from taking vitamins and eating certain foods. They can't know that. So I take all of those suggestions in the manner in which they were intended. And I also do my own research. So I've definitely asked my oncologist questions about popular and maybe clicky treatments out there to see what she has to say about them.
We are talking with Janet St. James, formerly of WFAA, now with HCA in Medical City here in the
Medical City
Metroplex.
Healthcare, yes.
And we are going to continue this conversation with Steve Love here on the human side of healthcare right after this.
This is the human side of healthcare on 1080 KRLD and the radio.com app, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
Welcome back to the human side of healthcare. We're going to continue our discussion with Janet St. James, and we're delighted she's here with us today. You know, Janet, in the previous segment, Thomas asked you about people that communicated with you on social media, especially on Facebook. And not everyone does communicate with you on Facebook, but we do have some listeners. Do you have any words of wisdom or nuggets that you want to share with them if there are listeners that are facing or have family members or friends that are facing what you're facing?
That's a tough one because everybody's experience is unique to them and unique to their families. For me, I found that it's very important for me to surround myself with positivity and joy. That doesn't mean that every moment of every day is joyful, but I've definitely found that surrounding myself with people that are positive definitely helps me manage some of the depression that goes hand in hand with cancer, and certainly with a terminal cancer diagnosis. I mean, I can't change what that is, but I can change the people that I'm hanging out with.
When we talk to people with chronic illness, and now we're talking with you about terminal illness, of course, there's going to be sad days. There are going to be depression. There's going to be times that you aren't as positive as you'd like. So I think that's great advice. Surround yourself with positive people, positive influences to help you as you go through this.
It's been interesting for me as well, working at a healthcare system. Medical City Healthcare has been nothing but kind, decent, generous, and wrapping their arms around me as if I am their family. They have certainly cared like family. That makes a big difference because they understand as well that ups and downs go with a disease like this, and they are willing to roll with the situation as the situation develops, which is an unusual circumstance, I think, certainly, and definitely speaks to the credit of Medical City Healthcare where I work.
That was going to be one of my questions, is since we're having an industry conversation here, right? As you say, you stepped into this right at the end of the day before the day that you started this new job after a legacy at WFAA. That had to have, I mean, talk about just multiple transitions at the same time. Wow.
Yeah, I thought I was going to leave the hot seat of news to have long lunches in the strategic communications department.
Goodness.
That hasn't happened. I was told from a dear friend that no one would ever hire me with cancer. And so when I showed up on that Monday morning and said, I'm going to need to speak with HR, I really thought they would say, you know what, why don't you go back to what you were doing before? Because they could have. I mean, I wasn't officially hired there. They absolutely could have said, instead, they said, we're working this out for you. We want you. You are part of our family. And that speaks so deeply to me of a connection of decency and the mission statement to the care and improvement of human life at Medical City Healthcare, which you don't, until you live it, you don't really understand what that means. And now I really do. It's certainly been a positive experience to work there under those circumstances. And when I was diagnosed with metastatic breast cancer, they were like, tell us what you need. We're going to work through this with you. You are our family.
And you'd been there one day.
That was I had been there
wow.
I'd been there like 30 seconds when they said that, but after metastatic breast cancer a year ago, I mean, it was the same
thing.
philosophy. Mm-hmm.
Okay, so let's talk about the stigma of this, right? All of a sudden, do people relate to you differently? How do you want people to relate with you?
Well, I think I'd been on TV for as a veteran. I had been on TV for a long time. I'm still fairly well recognized in public, and I can see on people's faces the stigma of how they think I should look, and sort of being I don't know what the right word is. Like, I'm a center of attention, but not necessarily in a positive way. I think sometimes people want to feel sorry for you, and I don't want to be felt sorry for. I find that to be a really awkward situation to be in. So I hope that looking better than people think that I should helps break that stigma a little bit. I don't want anybody to feel sorry for me. This is not anything that I did, not anything that they did, not anything that anyone can help, and so I don't want to be felt sorry for.
You mentioned something earlier, and this is obviously a very serious topic that we're talking about, but you strike me as the kind of person that would be a really compliant patient. You would listen to your oncologist, et cetera. But the dietary restrictions, is there one particular food that you just wish you could eat that you can't now?
I don't think that there's one thing that I I don't eat much meat. I consider myself a pescatarian. I'm mostly vegetarian, but I can't eat anything like tofu or soy or anything like that. My cancer is hormone fed, so I have to stay away from anything that could manifest itself as a bioidentical hormone. So I won't touch anything that's touched tofu or anything like that. And so I used to love hamburgers, so I have to be careful about if I'm having a vegetarian hamburger too.
Yeah, some of those new burgers that are out that are plant-based and, vegan-based. And so you have to watch all of that.
I watch all of that. And I'm compliant-ish. I'm mostly compliant, but nobody's perfect, right? Everybody.
I know I'm not. I know. I try to do what my doctor says, but I sometimes slip and don't.
I'm still striving for perfection. I'll let you know when I get there and what the magic trick is to that.
Your kids are now in college.
And one in high school.
One in high school. Mm-hmm. Talk about the family dynamic.
I think because I don't act sick for them, I'm still just mom. And I still tell them that they need to do their homework and they need to clean up their room and come down and have dinner. And are they having anything green with their dinner? And so I think that hasn't changed that much. I'll tell you, initially, after metastatic breast cancer diagnosis, it was right before the holidays, and that was tough. A story about my son who's still in high school. I really didn't know if it was going to be my last Christmas. And so everybody was home and we were decorating the Christmas tree, or we were going to decorate the Christmas tree. And he wasn't home yet. And I'm like, you need to hustle home. I was literally having a nervous breakdown. And he got a speeding ticket trying to hustle home. So I think that, yes, it was his first and so far, knock on wood, only speeding ticket. But I think it's affected them in some ways. Like they can sense an urgency in some things. But for the most part, I'm still normal. And also because I'm working full time. That's another stigma. You don't have to be on disability. You don't have to be at home in bed all the time. I'm working full time. That has not stopped at all. Even when I work from home, I'm still working 10-hour days. I think that helps with the normalcy a little bit more.
We were going to ask about that. So what is it like working and dealing with this?
It hasn't really changed for me, except that, I obviously don't work when I need to go to doctor's appointment or have an infusion, though you can do so much from a computer and a cell phone now. That doesn't really stop me either, unless there's no Wi-Fi. But you can do so much from the palm of your hands now.
Janet, we talked about social media and Facebook, and I'm sure some of the people would like to reach out and communicate with you. Would you be willing to share some information related to Facebook?
Absolutely. You can like my business page. It's Janet St. James /business. All you have to do is like it, and I post most everything there. You can follow my journey, my blogs. I talk about everything from positivity to depression to treatment to how I'm doing. And you can ask me anything, and I'm always open for ideas to talk about. Absolutely. I would welcome that.
And she is very open on that and has a lot of love and support for sure.
In the first segment, when we began this broadcast, I said that you used to ask me questions. So let me ask you this. What question should Thomas and I have asked you that we didn't ask?
That is the last question that I ask anyone that I'm interviewing is, what did I forget to ask you? I don't think that you guys forgot to ask me anything. Maybe I came prepared to answer a question that I thought you might ask, which is, what do you think my legacy should be? I was asked that question before, and I thought that I provided a horrible response to it. So
take two.
So the more I thought about it, the more I thought that for me, so much of my life has been wrapped around truth, and the truth is deeply ingrained in my soul. And so I found a quote from William Shakespeare, at least we think this is a William Shakespeare, that I think sums up. The quote is, "No legacy is so rich as honesty." And I think my legacy should be honesty in all parts of my life, whether it's cancer or how I work, how I live. Honesty.
Well said.
I was thinking when we started talking about doing this show and the conversations were about putting it together, there was one episode that I had floating around in the vision of my mind that we might be able to do, and we just did it.
Wow.
Thank you.
Well, that's a first for me. Thank you.
Janet, we want to thank you for being with us. I know this is a topic that our listeners need to hear about. And I know on behalf of the listeners, we thank you for sharing your thoughts with us today, and thank you for being on the human side of healthcare.
Thank you so much for having me. It's good to be anywhere these days.
This program is paid for by the Dallas-Fort Worth Hospital Council.
The DFW Hospital Council, along with our over 90 member hospitals in North Texas, are proud to bring you the human side of healthcare with Council President and CEO Stephen Love and co-host Thomas Miller.
And welcome back. Hope you caught the last two segments, our interview with Janet St. James. If you did not, then we have that on our podcasts, which are on all the major podcast players. All you have to do is search the human side of healthcare.
You know, Thomas, as we begin these segments, what an incredible lady, Janet St. James. And, you know, she wanted her legacy, she said, to be honesty. I don't think there's any doubt about it. What an honest, warm, caring individual.
Yeah, she is special. She's special in all of our hearts, and it was great to see that she is doing still quite well.
Absolutely. And as we continue our discussion, we're going to learn about some unique programs here in North Texas, especially affecting minority women.
Yes, sir. And the first of these is a mobile mammography program based at Methodist Health Dallas that has been serving the community for 29 years now. So to tell us about it is Charla Gauthier, Executive Director of Quality and Outcomes Management, Oncology at Methodist Health System, and Sheri Mathis, who is the founder of the Mammogram Poster Girls and is a breast cancer survivor herself, and whose organization helps fund this incredible program. So here's Steve with Charla and Sheri.
So let me just throw the question out. Methodist has a mobile mammography program. Can you give the history and tell me about that?
Yes, so the mobile mammography program at Methodist Health System began in 1991 as a way to address barriers to care within our community. So you can imagine today there's still some areas within the DFW Metroplex where women are faced with the barrier to care of transportation. There's no public transportation near where they live. The imaging centers and hospitals are more than 10 miles away. They don't have insurance. There's language barriers. The list just goes on and on and on. So the mobile mammography program tries to address some of those barriers to care, essentially lack of insurance through some partnerships and lack of transportation by bringing the screening mammogram to where the lady resides.
You know, you've just touched on so many of the social drivers of health. You know, the economic condition of the person, if they have any form of travel, and of course, in some of the areas, because of the poverty and because maybe they don't have insurance, they may not seek treatment. So mobile mammography, how is that different than when you go to an imaging center?
That's a great question. So essentially, it's the exact same procedure. It's the exact same equipment, exact same staff, exact same physician. The equipment is licensed and certified through the American College of Radiology, as well as through the Texas Department of Health and Human Services. So a woman can go on the mobile mammography unit knowing that she's getting the exact same treatment as if she went into a hospital or an imaging center.
So how do you schedule that? Do the women have to call, or do you have a schedule when you're in the communities? So how do the women actually access this great care through the mobile unit?
So our preference is for whatever site we're working with to market the event, and it'll have our phone number listed. So as the women are calling in to schedule an appointment, we're also collecting some vital information that'll help us to pre-register her for her procedure, and that will speed up the time that it takes to perform it once she does come on the mobile mammography unit. There are some locations that prefer to schedule their own appointments, and what we do is we provide them with templates and guidelines to help them essentially schedule the appointments, but then they send the list into us, and we put them into our medical record system, again, to speed up the registration process for when a woman comes on to the mobile mammography unit. So we're looking at anywhere from 15 to 20 minutes for a lady to get her screening mammogram versus, 30 minutes of having to fill out additional paperwork. So,
that's a good point. And your mission is such a good one, but many of these women are uninsured. How do you provide that service if they're uninsured?
It is through some vital partnerships with, for example, Sheri Mathis, who is the founder of Mammo Poster Girls. So what Sheri does is she helps to fundraise for underserved women in our community so that we can eliminate that barrier to care of lack of insurance and lack of affordability, so that she can schedule her appointment. We let her know that it's sponsored by Mammo Poster Girls. Any follow-up procedures that may be recommended as a result of the screening mammogram, Mammo Poster Girls is gracious enough to sponsor and pay for those services also.
That's a very important point you made, because when you perform the service, you may have to have a follow-up visit. And to know that these women that are uninsured are going to be taken care of is really something that is extremely important for our listeners to understand. So, Sheri, what a great mission. As you serve these people that are uninsured, in addition to the good work you do, tell us about Mammo Poster Girls, what you do, and how it ties in to the great work that Charla's doing as well.
So the Mammogram Poster Girls were founded 2 years ago. I've been raising money for mammograms through the Methodist health system since 2009. In 2018, we founded the Mammogram Poster Girls as a 501c3 so that we could expand our mission and help even more women attain these all-important mammograms, which I know all too well as a 2-time breast cancer survivor. I have 3 sisters who are also breast cancer survivors, all discovered via mammogram, which is what inspired the Mammogram Poster Girls, and for us to help other women become Mammogram Poster Girls.
So you just mentioned in your answer that you expanded this in 2018.
Yes.
As you expanded it, were there additional areas that you added to your mission? Were there additional things that maybe the board you set up has asked you to do, so our listeners can get a little better flavor for some of the things you've done since 2018?
So we started locally in Oak Cliff, which is where I'm from. Think globally, act locally. That's what we do. We began to raise money and realized fairly quickly, based upon the Komen recent research, that basically if you are in the southern sector of Dallas, the likelihood of diagnosis, of seeing a doctor, of having your annual mammogram is much lower. Therefore, the outcome is much worse. So our board decided that our expansion will be to the southern sector and to address that. And we've actually, in the last year, started a new initiative with the Mammogram Poster Girls, partnering with specifically construction companies whose employees might have insurance, but their spouses might not. So we've set up already at one point in November where we went to a company and I think we did 11 mammograms that day, and I think we funded all of them. The Mammogram Poster Girls funded all of them. So we can also partner that with companies as well, or piggyback if they go to a corporation or a company, and allow women who might not have access or insurance to have the mammogram.
You know, you bring up an excellent point, because in other illnesses, chronic illnesses, where we've talked to healthcare experts, zip codes come into play. Mm-hmm. And you've just talked about certain areas, maybe you don't have the routine test you need. So the mission you're doing is tremendous. And as was pointed out earlier, once that is completed, if there's follow-up treatment, you get involved in that as well.
Our mission is focused on early detection, so we will take them through screening and diagnostic, at which point I think there are other resources that can kick in at the different hospitals.
You know, I know that this was touched on earlier, and I'll ask you both, but especially for our listeners, in case they missed it, how can someone request that you bring that mobile unit to their location?
So they would call 214-947-1766. And all we would need is the location, the date, and the time of the event. And we will work with the site contact to make an arrangement to have the mobile unit at their location.
Is there a age restriction, or do you have a recommended age group that would participate?
Yes, so our program follows the National Comprehensive Cancer Network guidelines, which recommends for women to start having their annual screening mammograms at the age of 40. And we actually follow those guidelines for screening, prevention, as well as treatment.
You know, to our listeners, I hope as you've heard these two individuals describe the great mission that they're doing, that you will routinely follow the guidelines and get your mammograms, because it can save your lives. This has been a very interesting segment. What a wonderful mission. And we want to thank both of you for being on the show today.
Thank you for the opportunity.
Thanks for having us.
Charla mentioned the phone number to contact for this program. It's 214-947-1766. That is also in our show notes of our podcast. The Human Side of Healthcare is available on all the major podcast players. Now, coming up, Steve Love and I continue this theme of cancer resources. We're going up north this time and talking about resources for Asian language women in the Metroplex. That's coming up next on the Human Side of Healthcare.
We're continuing our conversation on how you can empower yourself to have the best health possible in today's ever-changing healthcare environment. This is the Human Side of Healthcare with DFW Hospital Council President and CEO Stephen Love and co-host Thomas Miller.
We're back as we continue this theme of breast awareness. We're going to move to Richardson, and we're going to see what they are doing at Methodist Richardson for the Asian population.
And joining us now is Doris Cheng. She's the project coordinator of the Asian Breast Health Outreach Program at Methodist Health Richardson.
What is the Asian Breast Health Outreach Project? When did it start, and how did it start?
We actually shorten our name sometimes because saying the Asian Breast Health Outreach Project for that long, it's just too long. So a lot of times, actually, we acronym our program ABHOP. So the ABHOP is a unique community outreach program that brings breast cancer awareness and screening access to our communities by targeting education, navigation, and the mammogram access to those, especially with English difficulties. Of course, it stands for Asian Breast Health Outreach Project, and it came about because it started 19 years ago because of a very low breast cancer screening turnout in our Asian communities, despite the large Asian community that we have in our area. So we realized most of the Asian populations nearby commonly spoke in their native languages, had no awareness of breast cancer or how to keep breast healthy. So realizing that this communication in our rich, multiple ethnic communities was lacking, our program was created to change that narrative. So as you know, the Asian community doesn't just speak one language. Asian populations come from different countries in Asia and speak different languages, 60 plus different languages, in fact. So we started with one language, Vietnamese, that quickly expanded to other mainstream Asian languages like Chinese Cantonese, Chinese Mandarin, to Korean, Hindi, and Urdu. So as the program expanded over the years in depth and scope, we realized that the Hispanic population still had this same problem. And so we are speaking Spanish too now.
So when you look back to when many of the Asian women did not understand the importance of breast awareness as far as health outreach, would you say now that it's increased that you're covering most of the people, or do you still have more education and language barriers to deal with?
Because we cover so many of the mainstream languages, I want to say that the program definitely has bridged those gaps. more people are aware because they're listening to the message that we are bringing forth year after year. But as with any message, everyone has a different adoption time, right? So some might know of our program. That's why it's important to keep the awareness. They might not know that it's important to them now, but maybe 4 or 5 years down the line, they realize, oh, wait a second, I have a friend who just got breast cancer. Maybe I should take a listen again and start doing the screenings I should be doing. So that's why it's important that we need to keep continuing that stream so that people know that we are here in the community to help them at whatever moment they're in need to be helped. And as breast cancer is expanding worldwide, they are listening, and it is working.
If we drill down a little deeper, who exactly would you say this project is intended to serve in the communities you serve?
Actually, our program is here to serve everybody, but we do target especially to those who have English difficulties, because that's what the community is, or our communities is lacking in that communication connection. So even though we specialize in the ability to speak different languages, we help everyone at their point of need. For instance, some people actually have health insurance through their work or the marketplace, but because of language differences or just being new to using insurance or just never had a reason to go see a doctor to know that it's important to do their breast cancer screenings, they just don't do their screenings. So for them, our staff will help them in the language they're comfortable and make sure their insurance is all good before their appointment. When English is a difficulty, even being able to say out ID numbers, group name, subscriber information, whether a provider's in network or out of network, makes a difference in how you can access care. So we facilitate all that information so that they could help them, we can help them utilize their screening benefits without the fear of problems later. Because a lot of the fear is that, oh, I'm going to start doing this and then I run into problems and then I have to bother other people to help me. This program is to help relieve that. Now, others may not need the language help, but they need the financial help because they have limited income with no health insurance. So for them, we navigate them and provide the mammogram service that they need free. And for many others, they will need everything: language, financial, navigation assistance. At the end of the day, we just want to help.
This outreach to the community for women's health is tremendous, and it truly is making the community healthier. It's doing things to help the women, especially that you serve there in Richardson. How is this program funded, and where can people go to get help, more information, learn more about it?
Absolutely. We actually have a website called Asian Breast Health. It is in multi-language, Asian languages to help. And actually, if they just call our main line at 469-204-6888, it's a multi-language designated line that is answered by our own program staff. And they can get more information about, our program and what we do. But I do wanted to say the program works because of the innovation of the program and the fact that we are with the community every step of the way, starting at the community level. We go into different ethnic communities and bring breast health awareness at different community venues, be it a church, temple, community center, or health fairs. So when they see us at these venues, we build the awareness and the communication connection so that when they are ready to call us, they know it is the same program staff at the end of the dedicated program phone line, helping them schedule the appointment on our clinic day. And then on their appointment time, it is us again to greet them, to help them register, check them in, help them get ready for the mammogram, and then also provide the breast health education as they wait for their mammogram. So our presence gives them that comfort so that they are not alone and will never be lost in the process. So that's why calling our phone number would be the best way to connect. And as far as how we are funded, we are 100% funding dependent program. So APOP has been very fortunate in the grants we have received over the years, and we are so grateful to each and every one because it allowed us to provide care in our communities for the last 19 years. So we do not just work in the month of October, the Breast Cancer Awareness Month. Our program is here all year round, and we get so many phone calls asking for help. that grant dollars usually run out before our fiscal year ends. So I would love our listeners to know that their individual donations matter in the work of this innovative program that bridges the gaps of healthcare for the most common cancer in our community. So your donation, no matter what the amount, will meet the need where the grant dollar stops. It will mean we could help the next person who calls instead of sending them away. So please donate online at MethodistRichardson.thankyou, the number 4caring.org. So MethodistRichardson.thankyou4caring.org, and choose ABHOP for your designation. Help us save another person from breast cancer for another 19 years to come.
Doris, thank you so much for the good work you do in the community, especially in women's health. It's been a real pleasure to have you on the human side of healthcare. Thank you so much, and we appreciate what you do for our community.
Thank you, Steve.
If you would like that contact information that was mentioned in this segment, just go to our podcast called The Human Side of Healthcare. It's on all the major podcast players, and that information will be in this week's show notes, show number 8. You know, as we talk about healthcare every week here on this program, some of you might be thinking that this could be a career or a career change that you would be interested in. Well, next week, John Phillips of Methodist Dallas and also the board chairman of the Dallas-Fort Worth Hospital Council is going to talk about how he got into his position. Talking careers in healthcare, plus insights on injury prevention from Parkland, and a look at one of Steve's favorite topics, the social drivers of healthcare. That's all next week here on The Human Side of Healthcare. And be sure again to catch our podcast on all your favorite podcast players.